Welcome to our series of roundtable discussions on conversations on the care economy in Malaysia, taking place today and tomorrow at ISIS Malaysia. We have appointed Professor Datuk Dr. Denison Jayasuriya, who is a senior visiting fellow at ISIS Malaysia, to facilitate these conversations as well as organize a national conference and a publication on this theme. He comes to us with a wealth of knowledge as an academic as well as a practitioner in social work at the grassroots. Together with him are policy researchers from the My SDG Centre for Social Inclusion, which is the policy research and advocacy unit of the All-Party Parliamentary Group Malaysia on SDGs. I am happy to know that over these 2 days, there will be 4 roundtable discussions with a focus on going deeper into understanding and setting a new policy framework on the care economy. These 2 days are an occasion to hear views from academics, public sector policy makers, civil society, care workers, and care providers or operators. As discussions on the care economy have moved up the agenda in recent years, this space for open discussion, dialogue, and conversation is absolutely crucial. The focus of the roundtable discussions are as follows. Roundtable discussion 1 advances the need to articulate care economy as a new economic growth center. Roundtable discussion 2 focuses on the need to hear ground voices on this theme. Roundtable discussion 3 looks at the imperative to shift care work from informal service to professionalized service. And Roundtable 4 centers on the need to define roles, especially of the public sector, if the care economy is to be viewed as a public good and its implications. Well, just last week, ISIS Malaysia launched a policy paper, Building a Cradle-to-Grave Care Economy for Malaysia. Indeed, a theme which emerged from the 2023 Praxis Conference. This ISIS Malaysia document is an important policy contribution for Malaysia to recognize the changing demographic trends towards an aging society which requires special services for the elderly in society. This is in addition to the needs of childcare, people with disabilities, as well as special care for those struggling with mental health issues. Hence, it is necessary for Malaysia to adopt a life cycle approach to care and ensure that care services are seen as a public good. There is a need to strengthen the policy environment to adopt a multi-stakeholder approach where the private sector, voluntary sector, and the public sector share this burden of care. ISIS Malaysia also recognizes that currently a majority of the caregivers are women and are among the many unpaid care workers. It is significant to acknowledge that this is valued in national GDP figures amounting to 379 billion ringgit. I wish you all well and look forward to reading the findings of these 4 roundtable discussions. I leave you in the able hands of Professor Datuk Dr. Denison and all the moderators and facilitators.